American Medical Review is a national platform where science and art meet, where improving and preserving health and wellness takes center stage, where the spotlight seeks out and shines on the healers and innovators. These editorial profiles, presented on national television, single out advancements in medical treatments, procedures, and services. Advanced Biomedical Technologies was handpicked as a featured guest because of its commitment to promoting progress in the field of health and medicine. More than 100 years ago, scientist and engineer Nikola Tesla postulated the healing effects of electricity and electromagnetism. Originally scoffed at by the medical community, electricity today plays a key role in both diagnostics and the treatment of disease. Understanding the therapeutic effects of electrophysics has evolved into the discipline of energy medicine.
Electricity is a very therapeutic and useful tool in treating patients, whether that's microcurrent or different types of functional electrical stimulation. They all have an amazing role to play, I think, in healing aspects as well as the functional aspects of the body.
Understanding that almost every process within the body, from digestion to muscular movement, has an electrical component, medical engineers are developing devices with broad applications using the concept of targeted microelectrical stimulation.
Selectively, when you can control current, you can do more for the tissue. It's proportionate to the needs of the tissue. If you have an injury, you can consider the area of injury or pathology will have a different electromagnetic strength to it. And what the instruments are doing is picking that up and adjusting it.
A recent study published by researchers with the Fermi National Accelerator Laboratory indicates the benefits of microcurrent therapy in treating some of the side effects associated with radiation oncology.
One form of a particularly unpleasant side effect is what we call fibrosis. Fibrosis is a special form of scar tissue that forms on the patient's skin in the area where the radiation first entered. As a physicist, I was just really fascinated with the idea of using electricity to treat a physical problem. We developed a range of motion measuring system that could measure the limitations that the patients were experiencing as a result of the radiation. We treated them twice a day for a week with an Accuscope MyPulse protocol. At the end of the week, we remeasured them. Every single patient had a positive result. Everyone had some gain in range of motion.
Arlene Frelk is among a growing group of others who have also been receiving energy therapy for the treatment of a neuromuscular disorder known as reflex sympathetic dystrophy.
I couldn't pick up a pencil. I couldn't write, and I'm right-handed, so I see notes from way back when, you know, when I had this huge hand, and I was just unable to use it for anything. I couldn't pick up anything, and I had 3 treatments a day, and by Friday of that week, I could actually move my fingers just a tiny bit. I've got some disfiguration from the swelling period. You know, you can see that it's disfigured, but it's usable. I can write. I can use it.
I was having problems with my liver. So at that time, a friend of mine called and suggested I take a look at the Accuscope. So Roosevelt, Michigan, was a suburb of Detroit. I went over and visited a fellow there at the Accuscope, and I started taking treatments 3 times a week over the space of 4 months. And the first time I took a treatment, my enzymes dropped, and I would go see my regular medical doctor, and they'd run the blood tests, and because of that, I continued taking the treatments, and like I said, over the space of 4 months, I had a total recovery.
I used to have cluster headaches for approximately 15 years before we found the instrument, the Accuscope. And I've taken a few treatments with the Accuscopes, and it totally stopped the headaches basically then and there. I have been probably close to 15 years without headaches.
That is what gets me up every morning. The adrenaline produced through the ability of helping these people. Reflex sympathetic dystrophy, horrible TMJ disorders. When I leave a clinic, I've made friends. I've made believers. And this is where I get my adrenaline. This is what keeps me going.
For the last 15 years or so, I have been reading newsletters from both the alternative medicine community and mainstream medicine. And what I'm seeing now recently is that things I read about 10 years ago in the alternative letters, are being talked about in the mainstream medicine, and they're being accepted and recognized.
As public demand increases for non-traditional approaches to medicine, alternative practices may continue to generate a buzz within the healthcare community.
In order to get new approvals in different areas of medicine for the product, we have to have studies. So we are working diligently at getting these studies. We are opening 3 new research projects this year, all in medical schools or hospitals, primarily teaching hospitals that are going to be doing these various studies so that we can go to the FDA with proof to get the approval outside of just pain management. And this is exciting because this will be the first time that an electrical stim device has been given approval outside of pain management.
Wherever the art of medicine is loved, there also is love of humanity. Once again, American Medical Review extends a special thanks to the companies and organizations that have risen to meet today's health and wellness challenges.